Hydroxychloroquine. 6 months ago, most of us, pedestrians, never heard of it. Now it's the most controversial drug on the face of the planet. It's worse than heroin. It's worse than opioids. It's worse than anything. If you listen to the media and you listen to others, so-called scientists. Steve Hatfield is a veteran virologist, and he recently wrote, there are now 53 studies that show positive results of hydroxychloroquine in COVID infections. There are 14 global studies that show neutral or negative results, and 10 of them were patients in very late stages of COVID-19, where no antiviral drug can be expected to have much effect. Of the remaining 4 studies, 2 come from the same University of Minnesota author. The other 2 are from the faulty Brazil paper, which should be retracted, and the fake Lancet paper, which was. What is going on here? This is very bizarre. And then I have this, an article written by Harvey Risch, who is a professor of epidemiology, Yale School of Public Health, author of over 300 peer-reviewed publications. And he writes in part, I'm usually accustomed to advocating for positions within the mainstream of medicine. So I've been flummoxed to find that in the midst of a crisis, I'm fighting for a treatment that the data fully support, but which, for reasons having nothing to do with a correct understanding of the science, has been pushed to the sidelines. As a result, tens of thousands of patients with COVID-19 are dying unnecessarily. Fortunately, the situation can be reversed easily and quickly. So you read this as a non-medical expert, as a non-scientist, as a non-professor, and you go, what in the world is going on here? The president is promoting it. We see some doctors promoting it. They're blown off Twitter. They're considered kooks. And here we have this top Yale professor who says, wait a minute, that's not true. Professor Risch, how are you, sir?
I'm good. Nice to be here.
The question is, you've looked, I take it, at all these studies, and what do you conclude?
I conclude the evidence is overwhelming. There's no question that in the people who need to be treated and are treated early, it has a very substantial benefit in reducing risk of hospitalization or mortality. And there's been a massive disinformation campaign that stretches from the government to the media that's either suppressing this message or it's countering it with a false message. And I'm not an expert in the reasons why that's happening other than just observing it, but I am an expert in the science, and I can tell you the science is all one-sided. In fact, the science is so one-sided in supporting this result that it's stronger than anything else I've ever studied in my entire career. The evidence in favor of hydroxychloroquine benefit in high-risk patients treated early as outpatients is stronger than anything else I've ever studied. So scientifically, there's no question whatsoever.
And most of the studies that are cited by the government scientists and the media are studies that do not treat patients early in the virus. Is that correct?
It's either that they cite studies that are hospitalized patients, or they cite studies such as the Bulwer studies from Minnesota that treat low-risk patients. These are people under age 60 with no chronic conditions and so on, people who will survive the virus with just on their own without treatment almost entirely. And those people, virtually nobody's hospitalized, so there's no room to do better when the people who don't get the medication are already doing as best as one could hope. So those are low-risk people, and we're not talking about treating low-risk people. We're talking about treating people over 60 or with chronic conditions or obesity, diabetes, and so on. Those are the people who are at risk of being hospitalized and dying from this illness. Those are the people who have to be treated. And all the studies, every one of the studies that looks at that group of people has shown benefit. There are no studies in those people that show lack of benefit.
Dr. Anthony Fauci, he's been in the government 52 years. He heads the infectious office in the federal government for a very, very long time, really over 3 decades. And when he's asked about this during testimony, he absolutely blows off hydroxychloroquine. He says the science is the science. You tell us the science says yes. He says no. Has Dr. Fauci ever called you and asked you your opinion and why you have the opinion that you do?
No. Dr. Fauci has...
And you're renowned. I've done research on your background. You're a renowned expert. You're at one of the top schools in America. Let me ask you this. Has the head of the Food and Drug Administration, the FDA, ever contacted you and asked you about your review of these various studies?
He's not contacted me for that purpose. During the time when the FDA was considering a petition for early use authorization in outpatients of hydroxychloroquine that was submitted by the Henry Ford Hospital doctors, during that time I filed a brief with the FDA demonstrating both the evidence that supports the usage and the complete lack of harm, the complete lack of any systematic data that the FDA has said on their website that they don't have. Just reading what they say on their website shows that they have no data about adverse events in use in outpatients. He responded, I sent him this by email as well as FedEx, and he responded thanking me for that. That is the only contact I've had with him.
So none of the heads of these various government entities have bothered to consult with you. And basically, when you go on these various media programs, particularly on CNN, they spend most of the time reclaiming their time and interrupting you and making it impossible for you to explain why you have the position that you have. And when we come back, I want to spend a little bit more time looking at these studies. We'll be right back. Welcome back. Dr. Harvey Risch is an expert epidemiologist from Yale, a PhD, a doctor. Doctor, I want to ask you this question. People with heart disease or asthma, are they likely to die or have a certain type of critical reaction to this drug?
No. The evidence is that healthy people with heart disease generally do fine on this medication, but like any medications, they should be prescribed by a doctor who's actually following the patient, knows what to expect, and is able to monitor it. And all medications should be used that way, and this is no different. But in general, this is a very safe medication. The medication itself has, in some people, perhaps 10% of normal people, can change the pacing of the heart muscle contractions, called the heart rhythm. That change has only measurement value. In other words, if you measure it on an electrocardiogram, you can see it. It has essentially no bearing for almost everyone who has that as to any risks for a real arrhythmia that has potentially life-threatening consequences. It is a very, very, very low risk.
It's interesting you should say that. On May 15, the Washington Post, drug promoted by Trump as coronavirus game changer increasingly linked to deaths. That was the headline that was blared. Is that true? It's increasingly linked to deaths? And what's their data for this?
First of all, it doesn't say in which patients. If you're talking about very sick hospitalized patients who get it as a last-ditch effort because nothing else is working, then there might be some relationship like that. If you're talking about healthy outpatients who are getting it among for example, the 10 billion people who've gotten this over the last 65 years, there's no relationship at all. And so you have to be very specific about who you're talking about when you make statements like that.
You know, again, as a pedestrian, no expert, but I read the various reports, I read what you write, and I draw my own conclusions from this. It is incredible to me that in the middle of this pandemic, that a drug that has been used for over half a century, where the testing has been so thorough and it's been ubiquitous, and it's so cheap, each pill is very, very cheap, that there is this effort to fight it and to destroy the doctors and the experts who dare to suggest that in the early stages, or even maybe as a prophylactic, you might want to use this if it's prescribed by a doctor. Now pharmacists are afraid to provide it. And now doctors are concerned to prescribe it. And hospitals, some hospitals won't prescribe it. And this has been politicized in an incredible, incredible way. And you write here, wait a minute, this drug can save thousands and thousands of lives. Have you ever seen anything like this?
Never, never. That somehow we've let politics overrule science. And it's an absurd situation. People have compared this to 1984 and the Ministry of Truth and so on, that's limiting what people can say on objective facts. It's beyond belief.
And I watch when you do interviews on other networks, these so-called news hosts are literally angry at you. They're shouting you down, they're interrupting you. They won't even let you make your case. That seems a little odd too, doesn't it?
Well, here's the thing. I think they know that the treatment works. I think that basically they're afraid to even let it be tried, because letting it be tried would show that it works. So the message has to be shut at all costs, because anything will leak out. And in fact, it is leaking out. And you see across the country people who started to speak up, who've become almost deathly ill and have been turned around in 3 days or sooner even. And these are now public figures who are speaking up, who've said that the medicine saved their life. And it's very difficult to, close all the leaks in that dike that are being suppressed by the media that are trying to do that.
But it's also being suppressed by individuals in these various scientific and medical communities in the federal government who've been around a very long time, the bureaucrats, if you will, who are claiming that they're the ones following the science, and you and people like you are not following the science. And when we come back, I want to ask you about that as a professional, as an expert, a man who's been in this field for decades. What can be done when the bureaucrats in the federal government, who are backed up by the media, because, from a political perspective, this is how they approach it. What can be done in the private sector when you have experts, when you have people, professors at universities, doctors who've been practicing and say, wait a minute, we need access to this drug, our patients need access to this drug. We'll be right back.